Welcome to City News. Ontario's mask mandate for high-risk settings like hospitals, long-term care homes, and public transit will be extended until the middle of June. And this comes as the pandemic is once again putting a major strain on the healthcare system, with staffing shortages hitting record highs in some regions.
We're still on an upward trajectory in hospitals. Their peak is probably still potentially 2 to 3 weeks out.
Lauren Cipriano is a member of the Ontario Science Table's modeling consensus team. She tells me staffing shortages in many areas are at record levels and the virus is still burning through communities.
So in the PCR testing, we ended up actually peaking higher than we did in wave 5 in terms of the number of staff that were out testing positive on PCR. But that's only a partial picture.
Long COVID, household exposures, and typical cold symptoms are also keeping healthcare workers off the job. Many hospitals right now are in the middle of a juggling act, moving staff from one department to another. Regions north, east, and west of the GTA are the hardest hit, with some surgeries and procedures being delayed.
People are shifted from so-called elective procedures like non-emergency surgeries and endoscopies into essential services like ICU in the emergency department. And we're seeing all of those things at London Health Sciences Centre right now. People are going to wait longer for some of the surgeries they've been waiting for because of these staff shortages.
The health minister was asked about this during a hospital funding announcement in Uxbridge.
There's not many good things you can say about COVID, but one thing that has happened that is positive is the very collegial relationship that all of the hospitals in Ontario have with each other. And so they're helping each other get through this short period of time until everybody's back at work.
City News checked in with a few of the hospital networks here in the GTA, and well over 1,000 healthcare workers are off the job. UHN, for example, is down 312 staff today and says the 7-day rolling average for test positivity among those reporting symptoms or exposure is more than 44%. But overall, the Toronto area is faring better than other regions simply because we have more healthcare workers and hospital beds per capita. But in the coming weeks, Cipriano says there will be more pressure on the system.
Small community hospitals are reducing their emergency department hours. That's going to cascade into other parts of the healthcare system, making longer trips for emergency services like paramedics. That's going to move some of that demand into the city centers that are able to maintain their emergency department hours.
Now, there is some good news in all of this. It still appears that the number of infections is slowly heading downward in most of the province, even though we may still see a little spike from the Easter long weekend. But once we're out of this wave, Cipriano says the learning to live with COVID policy means that in the new normal, there will be a higher rate of sick leave than what we saw in pre-pandemic times.